look at is, how do you build on the success story of one nation, and then how can we learn from that so that we can start collaborating across borders, because that is absolutely critical. And I'm talking about the test and treat model that Egypt has been able to do under the leadership of the Honorable Minister Abdul Ghaffar. We've seen that yours is the model excellency on how we can actually stop something that has been plaguing humankind for a long time. How can we really deliver on that? And this is an example that we all talk about. I would love to hear from you, Excellency. What has worked? How did this test and treat response for hepatitis emerge? What are the lessons? How can we learn from the example of Egypt's work in this space? Over to you, Excellency.
Well, thank you so much for inviting me. It's a really pleasure to join you in this important session. I think this has started more than 15 years ago. So I was lucky enough to be at the time when we got the award from the World Health Organization for the golden tier elimination. But the story has started really because of a scientific dedicated committee that started to put their effort to decide that we have a problem. We have a disease burden in Egypt. We have hepatitis C, considered one of the top prevalence worldwide. So at the beginning, we set the target. We have some health issue that we need to tackle, and we need to all to work together. And the issue for combating such a problem, it's not only for the Ministry of Health. It needs a lot of effort from different places so that we can have this in mind, and we all work to achieve this target. One important issue that started, I think, 2014 was the political will. I still remember our President Fattah al-Sisi, when he came out, when he was just considering electing himself as a president of the country. He was asked about what are you going to do with hepatitis C. So there is a famous tape that he mentioned that I want to get rid of this. I want to do everything that I can to support our country to eliminate hepatitis C. At that time, when you listen to a political leader saying that, I mean, this is something nearly impossible. Getting from almost 12, 13, 14% of the population suffer from hepatitis C, and you want to eliminate it, to eradicate it. So it was almost a dream at that time. But that brings you to the importance of what we call a political will. So political will is one of the determinant factors for that particular achievement. Then there is a scientific committee that worked together very hard to set down the roadmap. How can we work together in order to eliminate that? We started that fragmented efforts usually fail. So we have to work together. We need an integrated test to treat ecosystem. And depending on our primary health care, distributed in different provinces and governorates, with the strong political leadership, with the strong scientific backup from scientific leaders at that time. And then we started to do the mass screening. So we have the political will, we have the finance, with a very limited budget, but it's very efficient at the same time. And that proves that you don't have to have the best finance, and you don't have to have the best digital transformation ever, but you can use your own resources to achieve the same target. So we started screening, embedding this screening in primary health care with immediate linkage to treatment reliable data system. And certainly one of the important factors after screening more than 65 million citizens, and that's, I think, and this was declared by the World Health Organization as the most screened, or the most screened number of citizens worldwide. Screening 65 million discovering 4.5 undiagnosed hepatitis C, directing them immediately to point of care. And now comes the solidarity between pharmaceutical industry and local production of the medication. This is another success story, because if you diagnose without having the proper treatment, then this means nothing. If you have the treatment without proper diagnosis, that means nothing. That's why we're talking about from test to treatment. This is an ecosystem that we adopted at that time. So awarding the patient this medication after locally producing it in Egypt by national companies and national pharmaceutical industry that worked hard in order to do that, then we gave the patients this treatment free of charge. So affordability and accessibility for treatment is another success pillar in that. So in less than 10 years, we moved from hepatitis C in Egypt to be one of the most prevalent countries worldwide to achieve the pathway towards elimination awarded by the World Health Organization in 2023 the golden tier for elimination, and I think this was the first country worldwide to achieve that. So that's a great achievement, moving from one of the most prevalent countries worldwide to now, according to the step-down survey that just announced a few days ago, we are now, Muhammad, 0.3 something? 0.28%. So we're moving from 13-14% to 0.28% of the population, and we're ready for the World Health Organization visit to check all what we've been doing. So this proves that not only a medical achievement, it's a system achievement. And again, it doesn't need a huge investment or a huge finance to achieve that. It all needs dedication and political will and people that really needs to do something for their country. So moving and proving that diagnosis and diagnostics and treatment and financing and regulation and manufacturing operate in one cycle. So these are what we call it the whole system and the whole ecosystem that we have to follow. So I think if Egypt achieved that in less than 10 years, I think we can share that, and we already do that with different sisters and brothers from the African continent. We've done that also by sharing this experience with different countries like Russia, like Pakistan, like Kazakhstan, like from the African Center for Disease Control and Prevention. We also all the time we receive trainees to share with them our experience, because we have something that we are proud of, and we can share it with a very with high dignity, and we can definitely share this with other countries that we can help them to achieve the same results. So this is just in a nutshell the story of hepatitis C, that a lot of people, not just me, a lot of people and even my predecessors worked hard for that achievement, ministers of health and the scientific committee and the political will, after all, from the president, and that achievement is a group achievement. It's not just a personal achievement. Thank you.
Minister, thank you very much for